Hi, my name is Dr. Tori Hudson. I'm a naturopathic physician and member of Pharmaca's Integrative Health Advisory Board. I've been practicing women's health for 28 years, and one of the most significant health problems that women talk to me about is depression, and that might not be their primary thing that brings them into the office, although often it is. But sometimes it's a secondary or the third thing on the list. And I especially today want to talk about mild to moderate depression, because this is actually much more common in women than in men, so it is a bona fide women's health problem. And there are some actually excellent natural treatments for mild to moderate depression. It's something that we can actually take charge of and do a pretty good job of self-treating. Severe depression, probably not the case. But you've probably heard about St. John's wort, and this is one of the most well-researched natural agents for mild to moderate depression. And it's still, I think, a tried and true solution and approach for mild to moderate depression. There's some fancy things to know about in terms of dosing and concentration of what's called a standardized extract. A staff member at Pharmaca can help you with this information in terms of what product would be the most consistent with the research that's been done on St. John's wort. Another thing that we don't want to dismiss is the use of something called SAMe, S-adenyl-methionine, and this is a nutritional supplement, also quite effective for mild to moderate depression, that affects serotonin levels, much like some of the drugs that you know about. St. John's wort and or SAMe affect serotonin uptake and therefore improve mood. There's 5-HTP, which is a tryptophan product, or L-tryptophan. These two nutritional ingredients also improve serotonin and can be used as part of an approach to depression. Now, there are three important B vitamins, B6, folic acid, and vitamin B12. And actually, depression is the most common manifestation of a folic acid deficiency. So be sure to talk to your Pharmaca staff member about folic acid, because many of us, about a third of us, have actually a genetic defect where we don't actually convert folic acid into the more active form called folate, or L-methylfolate. And so some of us actually need to take that form of the folic acid called L-methylfolate, and it can have a dramatic effect on mood in this population of people that especially has this enzyme defect that's determined genetically. But B6, B12, folic acid, I think is really important to include in a good approach to depression, in addition to one of the other ingredients, the St. John's wort, a tryptophan, or SAMe that I mentioned. But there's some other neurotransmitters we maybe don't hear about as often as we do serotonin, like dopamine or norepinephrine. And the nice thing about that folate is it affects all three of the neurotransmitters. So that's a very important advantage. And an amino acid L-tyrosine, which comes as a supplement in a bottle, specifically affects dopamine. And L-phenylalanine affects dopamine levels. So these are, when we're thinking a little bit more holistic in terms of brain chemistry, we want to think about these three neurotransmitters. And if you're having premenstrual depression, then we want to treat your PMS with things like chaste tree berry and calcium and B6, and then we might want to support that with the St. John's wort. If we're menopausal-related depression, then look at the core, treat the menopausal issue with black cohosh or maca, or a combination product in addition to the St. John's wort or something else we just spoke about to address the hormonal issues and then target this depression-specific issue. So mild to moderate depression, you can do a good job. Don't forget the importance of exercise and fresh air and good diet and some healthy choices in your life. All right, take care.